We will talk about frequent yawning. It affects around 25% of world population, so it's common condition. And now let's define what means frequent yawning. If person yawns more than 10 times per day, it's considered frequent yawning. And what is the yawning? It's reflex and characterized by open mouth, deep involuntary breath followed by shorter exhale. And now explain why we yawn at all. First and most accepted explanation is temperature regulation, which means when we inhale cooler and colder air, and it cools down our brain. And when we exhale warmer air, and it also cools down our brain. And it's most accepted hypothesis, temperature regulation. A second hypothesis is oxygen and carbon dioxide theory, and it's accepted, of course, that we inhale oxygen and exhale carbon dioxide, but yawning correlation and yawning function here is not confirmed by studies. But it's still second most common theory about yawning. And yawning also can be social signal, for example sign of empathy. And among humans, yawning is contagious also, and it happens because of mirror neurons. We have mirror neurons, and they are responsible that when we watch something we do and we can mirror this action, and we can do what other people are doing. That's the mirror neurons and neurological mirroring, and neurological mirroring is responsible on yawning and contagious yawning. And also this yawning as a social signal is observed in animals also. For example, they using yawning as a synchronized for synchronization of activities. For example, among chimpanzees, it can be sign of resting, sign of get up in the morning, they yawning and moving together. So it's yawning synchronized activities among chimpanzees. It's important. And now let's say what causes frequent yawning. Most commonly, tiredness and boredom is most common cause of frequent yawning, around 70% of cases. And what is possible explanation? First is temperature regulation, of course, cool down brain, it's important, and more to get more oxygen. And also during yawning, our brain releases dopamine and it increases alertness. So increased alertness is function of yawning in case of tiredness and boredom, and it's important explanation actually. So dopamine, release of dopamine is important when we are tired, and we get more alerted. When we get more oxygen, our brain temperature decreases and we get more dopamine also. Second most common cause of frequent yawning is sleep disorders. It's responsible around 10% of cases. And when we say sleep disorders, we mean sleep apnea. Sleep apnea you may observe especially in obese people or in overweight people. When they sleeping, they repeatedly stop breathing and start breathing, and such people experience daytime tiredness, daytime sleepiness, and frequent yawning because they feel tired. That's the explanation. Same happens in case of insomnia. What is insomnia? Insomnia is difficulty falling asleep or poor sleep quality. And same happens also in case of restless leg syndrome. Restless leg syndrome is condition when person involuntarily moving his legs, and this usually happens and more pronounced during night, and such people's sleep quality is low and they can feel daytime tiredness and sleepiness, and that's why they frequent yawning also. Third most common case of frequent yawning is medications. Medications are responsible in 5% of cases, and especially Prozac, for example, fluoxetine and serotonin reuptake, selective serotonin reuptake inhibitors. Such drugs are responsible on frequent yawning. And why it happens? We have brain here and we have brainstem here at the beginning of brain, and this brainstem is responsible on yawning. But here we have these neurons which release serotonin also, and when we get this drug increases serotonin level, so these neurons are activated and person starts yawning, because they are same neurons which are responsible on yawning. That's the explanation. And fourth most common cause of frequent yawning is brainstem injury, because in the brainstem we have a center of yawning reflex, as we said, and brainstem injury triggers frequent yawning. For example, during migraine, what happens? There is hypothesis that during migraine, interaction between brainstem and trigeminal nerve is very important, and when trigeminal nerve stimulates brainstem, it can stimulate also yawning, and it precedes migraine attack. And what is migraine attack? Person has headache, it's throbbing, it's pulsating headache on the half of the head, one side of the head, not whole head, but one side of the head, pulsating, throbbing type headache is migraine. And frequent yawning can be preceded and after frequent yawning, migraine attack can start. That's the idea. So first is frequent yawning, second is migraine attack. And another disease which can cause also brainstem injury is multiple sclerosis. Multiple sclerosis is not considered frequent or common disease, but it's serious disease, and it means that when our immune system, our own immune system, attacks our tissues, especially central nervous system, and if our body will attack brainstem, person can have frequent yawning. But common symptom of multiple sclerosis is fatigue, difficulty walking, numbness, tingling, and muscle spasms. That's multiple sclerosis. It's serious disease, but it's a rare disease. And people with stress, anxiety, depression, panic attacks often experience frequent yawning, but it's usually secondary. It's not. There is no primary correlation between frequent yawning and stress or anxiety. It's usually correlated with tiredness and fatigue and poor sleep quality. And during hypoxia and lung disease also we can have frequent yawning, especially COPD, especially when blood oxygenation is decreased, and our organism, our body trying to compensate this with frequent yawning to get higher dosage of oxygen in the blood. And now let's touch when person wants to yawn but unable to yawn. It's also known as inhibited yawning or stifled yawn. And why it happens? It usually happens because of anxiety, because of panic attacks, and usually it's psychological and not physiological substrate. So when person says that I want to yawn but I'm unable to yawn, it's usually because of stress, because of anxiety and panic attack. Usually they are caused. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.